Chai with Cheruba. Um, really excited to see you all here to talk about a very, very important topic. Um, I am in the middle of moving, so I am literally sitting in my son's room and drinking some coffee. Today is not a chai day for me because I need extra, extra, extra energy to do all the things that I need to do to finish my move. So I'm going to be drinking coffee, but wherever you are in the world, I hope you grab your chai and join me for this really important conversation. Um, we're going to just wait for a few more folks to hop on. And by the way, I'd love to hear what you guys think about this series. I've had so much fun doing it, and I've gotten so many comments from people that this stuff has been useful. So hopefully you are finding it very helpful. All right, so um, welcome to Chai with Cheruba. Today we are going to be talking about the silent struggle of endometriosis. So I'm Dr. Prabakar. I'm a board certified OBGYN and minimally invasive surgeon. And in my practice, I see a lot of patients with endometriosis. And so I wanted to just give you sort of three bullet points to think about with endometriosis. So the first is endometriosis is more than just cramps and pelvic pain. Um, I see patients in my office who say, "Oh, I'm having really bad cramps, or I get really bad pain during my period. Do you think I have endometriosis?" Now, I mean, they could have endometriosis, but I do want to broaden our um, definition of what or what we think about when we think about this disease because it's so multifactorial, it's so complex. So, some of the things that you can think about when we talk about endometriosis is really, really painful periods, um, terrible cramps that actually put you out of school or work. Menstrual cramps are normal to a certain degree. Almost everybody gets some cramps, but you're still able to function and go to school and go to work and do the things that you need to do, maybe with a little Motrin or Aleve or ibuprofen. But if you are doubled over in pain and you cannot, function, you cannot go to school or do what the things you need to do, well, then that's a problem. So severe pain, severe cramps, very, very painful periods. Endometriosis can also present with a lot of GI symptoms. So diarrhea, constipation, just changes in your bowel habits. It can also cause nausea around the time of your period or even ovulation sometimes. Extreme pain during ovulation or like nausea during ovulation, painful sex. Um, Oftentimes, patients with endometriosis can also have some depression and anxiety, um, um, either related to the symptoms that you're otherwise feeling or independent, but still related to endometriosis. So, you can also have very painful bowel movements. Endometriosis touches pretty much all of our organ systems and our body systems. In extreme forms, endometriosis can travel outside of the uterus and can actually go to other parts of your body, including your lungs. We've probably all heard of extreme cases like that where your period comes and people have a hard time breathing, they're short of breath. And they can't seem to even catch their breath, or they have like asthma like symptoms every time they get their period. Then we start thinking about endometriosis in your lungs. Now this is pretty severe, and these kinds of cases are rare, but my point is endometriosis literally affects our entire body. So I want you to think about endometriosis as a very global disease state. It's not just your uterus. It can affect other parts. Some people will have like really bad sciatic pain right when they get their period, and they can't quite explain it, but that could also be endometriosis. And so think a little broadly when you think about this disease, and especially if you think, like I don't know what's going on with me, but I'm having all these, strange symptoms that don't seem to be related. So that's my first point that I want everybody to think about, that this is a much more involved disease. Number two, it is a it can be a silent disease, in that you can't always pick it up with imaging, but the struggle is not always silent, meaning that the struggle is real. So many women have told me that they've gone to different doctors who've said, "Oh, like it's all in your head," or this is just how it is, this is part of having your period, or well, look, I did the ultrasound, I don't really see anything, so you don't have anything. So it can be a silent disease in that sense. You don't always see endometriosis on imaging, which it makes it very, very challenging, but it doesn't mean that you don't have it. It doesn't mean that you're not suffering from symptoms. One of the things with endometriosis is that the the level of disease does not correlate with symptoms. So sometimes I've operated on patients for something else, like like fibroids, and then I'll go in and I'll see all this terrible endometriosis, and then I'll tell them later, "Did you know you had endometriosis?" And they'll be like, "No, never knew it. My periods were not that bad or anything." And other times, people will have like a dot of endometriosis and they have terrible pain, terrible periods, terrible symptoms, and so they don't always go together, which I wish everybody understood and didn't tell women like, "Oh, well, you don't have it." Like it's definitely not there. Um, the average It takes an average of about 7 to 10 years for women to be diagnosed with endometriosis. Like that to me is mind blowing. 7 to 10 years. So you go to all these different doctors with these symptoms, and thinking of endometriosis, and again they do the imaging. They're like, "No, you don't have it." The gold standard for diagnosis is laparoscopy. So got to put a camera into your belly button, take a look around, see what's going on, take some biopsies. I just did two of those, in the last couple of weeks, because patients came to me with all the classic symptoms of endometriosis, and they did the MRI, nothing, they did ultrasound, nothing, but they're like, "I'm having all these symptoms." So now sometimes we do find endometriosis, sometimes we don't, but the only way you'll know is by laparoscopy. So if you're out there and you're listening to this and you've been searching for a diagnosis, trying to figure out what's going on, and you've done a lot of things, then maybe the next step is laparoscopy to really try and figure out, well, do you have it or not? It's really important to know either way, just for your own self, for your medical record, and also treatment options. Because if you don't have endometriosis, but something else is causing pelvic pain, well, you want to find out what that is and go after that. Or if you do have endometriosis, you want to go ahead and treat that. So it's really helpful to know either way, as to what's going on. So that is my second point, that the disease can be silent, but the struggle is not always silent. It really wreaks havoc on many people's lives. Um, and then my last point here before I take some questions is about treatment. There are many newer hormonal treatments, and I want you all to be, just aware that it's more than just birth control pills these days. I think back in the day, hi Valerie, hi Doc, great to see you. So we traditionally it's always been like, okay, just go on the birth control pill and then that's it. Well, that can definitely be a start, but I really want you all to think about great lifestyle options, anti-inflammatory diet, stress relief. It's really a full package. And even as a doctor, early on in my career, I was like, "Oh, those things are a little woo-woo. I'm not really sure if those things work. Let's go after the meds." And the medications are quicker and they're effective. But, at the root cause of endometriosis, which we don't really know why people get endometriosis, but we know that a change in diet, a change in lifestyle can definitely help. So start there. And then we've got some hormonal medications like birth control pills and the progesterone IUD, progesterone pills, pills that suppress estrogen and progesterone. So lots of medication and medical options to be tried before surgery. And then again, for diagnosis, as I previously mentioned, you want to do a laparoscopy to make sure, and really see if that's what's going on. But then surgical treatment is the, again, gold standard for treatment. Getting in there, excising the endometriosis, finding where it is, removing it. This is what helps with symptoms. And it's not a magic pill. it's not like, okay, I'm going to do this and then my life is 100% better. It's often a condition to sort of be managed, but your life could be just so much better. So don't be afraid of surgery with endometriosis, especially if you've tried a lot of other things. Surgery is what actually removes the disease. And so often we do medical plus surgical together, but I just wanted to emphasize the importance of surgical treatment here. Again, it's not being very invasive or, quick to decide that that's what is right, but that's what works. So I do want to emphasize that. And as I mentioned, hormonal lifestyle options are key. So those are some of my tips for endometriosis, some things that I want you guys to know. And for those who are done having kids or not having kids, or if you're like that's not for me, those patients do opt for a hysterectomy. The definitive management for endometriosis is removing your uterus and actually your ovaries as well. But just removing the uterus gives a lot of patients really, really good relief. So, but that's kind of like the last option for those who've done all the things or, are at a point later on where they don't really want to deal with it anymore. So that's the whole uh, array of treatments. And I would love to take some questions. Okay. Hi, Philly. I heard endometriosis can affect fertility. Is this true? Yes. So endometriosis can affect fertility in a few different ways. So one is there's just something about endometriosis that causes subfertility, or even in patients who are undergoing IVF, it can make your success rates a little bit lower. We're not sure if it's the cytokines, the chemicals that these implants transmit to the other parts of your body, like your uterus and your ovaries and your fallopian tubes. But yes, there is a correlation. And then endometriosis can also cause scar tissue because things get stuck to each other with endometriosis. And in that case, your fallopian tubes don't work very well, or maybe your ovary is stuck to your uterus and not able to release as many follicles. Those all sorts of issues because of scar tissue. So that's how endometriosis can affect fertility. And if it can also cause big cysts on your ovaries called endometriomas, and in that case too, then your ovary is not can't get a lot of good follicles and eggs out of your ovaries. So it can affect fertility in several ways. That's such a great question. And the majority of my practice is, for endometriosis is for fertility, where patients are trying to get pregnant, or they have endometriosis, so they did one surgery, or now they're doing IVF and they can't get to the eggs because there's these big cysts on their ovaries. So yes, if you're somebody who's trying to get pregnant and you had all the symptoms that I described before, you really do want to get evaluated by a doctor. Okay, what other questions? Um, the real Annie Allen. Yes, when I had my myomectomy with a robotic surgeon, he found endometriosis. I went to many doctors trying to figure out my back pain and sciatica. Thank you for sharing this. Um, all that is gone now. Thank you for sharing that. As I said, endometriosis is not just pelvic pain and painful periods. This viewer had back pain and sciatica. So it can really, depending on where it's sitting in the pelvis, endometriosis can cause other symptoms. And this was sort of incidentally found when she was getting her fibroid removed. So that's actually what I see when I go and do fibroid surgery. I often see endometriosis, and they coexist in about 40% of patients. So 40% of patients will have, both. So if you have fibroids, in the back of your mind, you could think that, this may also be happening. Great. I'm so happy to hear that you're doing well. Um, what other questions do we have? Okay. What is the difference between endometriosis and adenomyosis? And do any of it prevent you from getting pregnant completely? This is a great question. So endometriosis is when the glands of the uterine lining start to go elsewhere. Instead of just staying in the uterus, they go through the fallopian tubes, they go to the ovaries, they go to the pelvis, they go to the bowel. They're found everywhere in the pelvis. Adenomyosis is where the glands, they don't go outside the uterus, but they bury themselves in the wall of the uterus. And so it can lead to extreme cramping and pain. And it's sort of a more sort of severe form of endometriosis. Now, it because it's in the wall of the uterus, it does not necessarily prevent you from getting pregnant if, again, if you don't have it elsewhere on your ovaries or your fallopian tubes. But it can cause pain. So severe pain and cramping is what I think about when I think about adenomyosis. And unlike endometriosis, adenomyosis can actually be picked up on an MRI. So there's a specific finding that I look for in MRI to tell me if this patient has adenomyosis. And so that helps me just guide them a little bit more towards what type of treatment, which a lot of them are the same for endometriosis and adenomyosis, but the surgery can be a little different. So that's a great question. This is often, they often go together. And if you are somebody who has endometriosis or suspected, you should familiarize yourself with adenomyosis as well, because they often do exist together. But adenomyosis by itself doesn't typically cause pregnancy issues. Okay, can you describe the different stages of endometriosis? Yes, there are four stages of endometriosis, and one to four, and one is just a few, dots of endo. Second is a few more. Third is more scar tissue now, and fourth is where everything is just stuck together, including the ovaries. So the ovaries, there's one ovary on one side, one ovary on the other side. In stage 4 endometriosis, those ovaries are so big and stuck that they're together in the pelvis. So those are the stages of endometriosis, and least severe to most severe. Okay, what else? Um, any other questions? I'm trying to get pregnant. I'm afraid I will have this. Well, I think the gold standard again is a laparoscopy. If you're trying to get pregnant, I would do a good evaluation if you're not getting pregnant, as to the male, the female, like all the reasons. Usually, if you have endometriosis, you're going to have some of these other symptoms that I talked about, so it shouldn't be a surprise. But if you've done all the things, then the last option is a laparoscopy to just see if truly you have it. Can I heal without surgery? It depends on your stage, honestly, and what your goals are. But yes, the anti-inflammatory diet, the lifestyle modifications, medication, all of these things can definitely help with endometriosis. So you don't need surgery. But again, if you're trying to get pregnant and if you have stage 3, stage 4 endometriosis, I do recommend surgery to try and remove the disease so you have a better pregnancy outcome. What other questions? If endometriosis is estrogen dependent, why is progestin only pill not the first birth control offered? This is a great question. And actually, in my practice, I do offer progesterone only. And there are some newer, really good progesterone pills now that are the mainstay of endometriosis treatment. With Sometimes we do a combination because there's a lot of other things going on. It's not just pain. Some people are having heavy bleeding, and ovulation pain, and other just general symptoms that are affecting a lot more of their pelvis and GI systems around there. And so sometimes the progesterone only is not effective enough to control all of that. So then we do an estrogen and progesterone. Now, obviously, we're not giving somebody just estrogen. We're always doing it in balance to make sure that the lining is nicely balanced. And that's the whole point of giving estrogen plus progesterone and not too much of one thing. So a lot of times this brings up another point. There's no magic pill for endometriosis. Sometimes I'm trying different things for different people. We start with one, 3 months. Okay, let's do another one. Okay, let's do this one. Is this better than that? So there is a lot of trial and error with endometriosis treatment, which is also frustrating. But that is the scenario. Okay, what else? How does menopause change? So with menopause, a lot of these symptoms should go away. So for patients who have been where it's popped up, late 30s, early 40s, or now they're like, what should I do? But they're also perimenopausal. Some will just decide to wait because all of this resolves in menopause, which is good news. But of course, that can be 20 years of dealing with it. But yes, it's good to know that menopause takes care of it. Okay. Um, are you sure that endometriosis definition is correct? Endometrial lesions are not displaced uterine tissue. Endometriosis is when the glands of the lining of the uterus are found elsewhere. That's sort of the definition of endometriosis, and we have different theories as to how that happens. But essentially, instead of staying inside the lining or the cavity, this tissue travels elsewhere. So that's the definition of endometriosis. Okay, what else? My surgeon also found adenomyosis during my surgery. Yes, adenomyosis sometimes can present like a fibroid. So we think that it's a fibroid, and we start opening it up, and then we find out it's not coming. It's part of the wall of the uterus. So again, the MRI can help us, but not 100%. So that's sometimes how we run into adenomyosis. A lot of other times, this is a diagnosis that the pathologist will give us. So we do a hysterectomy, we send the whole specimen to the pathologist, and then they say, oh, by the way, there was adenomyosis. It's not something we can biopsy always without surgery. And so sometimes we only find out later on that, oh, yeah, this patient had adenomyosis. Okay, I'll take a couple more questions if anybody has them. Can any gynecologist do a laparoscopy? So, as gynecologists, we are all trained to do laparoscopy. Most gynecologists, OBGYNs, do the whole delivering of the babies plus gynecology, which includes all the GYN surgery. But I will say that most people end up kind of choosing one or the other, or end up specializing in one over the other. So, when you do find a surgeon, you want to find somebody who does a lot of this. So there is a fellowship called the Minimally Invasive Surgery Fellowship, which I have completed. So we do 2 years on top of our residency, just in surgery, in more advanced surgery for GYN, so endometriosis, fibroids, adenomyosis. So you want to find somebody who ideally has that certification and that fellowship, or just somebody who operates a lot. And so you should never feel shy about asking your surgeon, hey, how many of these do you do on a regular basis? Do you see this a lot? And the good doctors who don't do it will say, hey, you know what? Yes, I know how to do it, but I really don't do it all that much. Let me refer you. So do some digging around before you choose a surgeon, and don't be afraid to get a second opinion. Good question. Um, Apart from excision surgery, what are the most effective ways of reducing inflammation inside the pelvis? There are some medications that actually bring down estrogen and progesterone receptors. I think those work really well. I've had great success with those. And then lifestyle. There is an endometriosis cookbook, actually written by Dr. Andrew Cook, who's a gynecologist. So that one, I don't have it right on hand, but that one is actually really helpful. I had a couple patients do some of the recipes from there, and they had really good. Their symptoms improved a lot. So check out that. It's called. It's by Dr. Andrew Cook, and I don't know the exact title, but it's something about and like endometriosis diet. Okay. Anything else? Any other questions? All right. Well, this was so much fun. It's April 3rd, but March was actually Endometriosis Awareness Month. And so I posted a few things on social media, but I wanted to actually dedicate a Chai with Cheruba session on endometriosis, because this is such an important topic. So many women are suffering from it. I see women all the time in my practice with endometriosis, and I do a lot of endometriosis surgery. And I'm bringing on in just 2 weeks. Another physician who's also certified and fellowship trained in minimally invasive surgery, who is an endometriosis specialist, to my office. So she's going to be joining our team. So if you are in the Bay Area, and you are looking for an endometriosis surgeon, somebody who has done a lot of this, and you have questions, you need surgery, or maybe you need medical treatment, whatever it is, come and see us. We'll post our information below. Myself, Dr. Prabakar, or our new doctor who will be joining us, Dr. Christensen. She has over a decade of experience operating with endometriosis. So we'd love to see you. Please share this with a friend, tag somebody who could use this information. Knowledge is power, and I really want women to understand more of this so they can advocate for themselves. Because, like I said, it takes almost 7 to 10 years before getting a diagnosis, which is a decade of your life. And we have important things to do. All right, everybody, have a great Thursday. Bye.